Good day, everyone. Our topic is all about growing management. When we say growing management, it refers to how we care or how we manage our poultry, but it includes vaccination, medication, and debeaking. Growing management is usually refers to the husbandry practices or production techniques that help to maximize the efficiency of productions. It includes the proper cleaning and disinfection of grower house is needed before introduction of grower birds. The second one is provide sufficient floor space, feeding space, and water space. Third is arrange feeder and waterers in the grower's house. Change the feeder and waterer according to the need. The next is follow strictly the recommended vaccination, medication, and other management programs like deworming, debeaking, and etc. for the growers. And the last is only 12 hours lighting program is sufficient in case of open-sided houses. No artificial light is needed. So let's move to vaccination. What is vaccination? Vaccination is a method of giving antigen to stimulate the immune response through active immunization. A vaccine is antigenic but not pathogenic. A vaccine is an immunobiological substance designed to produce specific protection against a given disease. So, what is the purpose of vaccination? The purpose of vaccination is to prevent or reduce problems that occur from infection of a field strain of a disease program. To incite levels of immunity to protect birds in the face of aggressive endemic disease challenges. Third is to prevent heavy losses in the form of high mortality, morbidity, and lowered protective performance by building up resistance in birds. The fourth is to hyper-immunize hens to maximize maternally derived antibody pass through the egg to the hatching progeny. So let's move to the methods of vaccination. The first method of vaccination is intramuscular injections. This method involves the use of needle to insert the vaccine into the breast muscle of chickens. As you can see in our PowerPoint presentation, makita ninyo dito ang example kung unsaon siya pag-inject sa manok kung asa nga part. Pero usually sa dughan jud sa manok. And then the next one is subcutaneous injection. It is very similar as the intramuscular injection. But in this case, the vaccine is injected under the skin, usually at the back of the neck. Narapod na sa kung maano siyang sample sa subcutaneous injection. And then the next one is ocular. The vaccine is administered to the chicken's eye via eyedropper. From here, the vaccine makes its way into the respiratory tract by the lacrimal duct. This method is kanang ibutang na bitaw sa mata, ipatakra sa mata sa manok. Gina-eye drop lang. The next is the nasal method. The vaccine is introduced into the chicken's nostril either as thus or a draft. Kanang isulod ra sa nostril sa manok, isuksok bitaw siya or pwede ra o lagi isuksok sa nostril siya sa manok. Then next is oral. Oral method is given in the chicken's beak. From here, it may make its way to the respiratory system, or it may continue in the digestive tract before entering the body. Adding the vaccine to the drinking water of your flock, kaning oral method is common ni siya sa tua. Makita ni siya usually kanang nay mga alaga nga manok bitaw, di ba? Kanang pananglitan si punon ilang manok kay ang tambal isago lang nila sa tubig, then ay pa dito na magtuka-tuka ang manok. These methods of vaccine is less time consuming and less stressful. Yes, kay dili naman sila maghago-hago, igo rato nila ibutang panalitan kung powder man tong anang tambal na ipainom nila, ikutaw rato nila sa tubig, dayon ang manok nang magkuan dili na sila magpugos pagpainom ana. The next is spray method. Spray method onto the chicken or into the air above the chicken by making use of suitable spray applicator that controls the spray droplet size. This chicken may also inhale small quantities. This is the example of spray method. Then the next one is type of vaccine. There are two types of vaccine, the live vaccine and the killed vaccine. The live vaccine contain attenuated organisms. Attenuation is a process by which the pathogenicity capability of producing a disease is reduced without altering the immunogenicity. It usually done by passage in embryos or cell culture. The live vaccines, as I have said, it contains the attenuated microorganisms, which are still capable of replicating with the host or the vaccinee. The microorganisms are weakened, meaning that they have lost most of their disease-causing capacity, but are still in possession of their immunogenic properties. In most cases, live vaccines show a significantly higher immunogenicity than inactive vaccines, since natural infection is imitated almost perfectly and eliciting a wide range of immunologic response. There are advantages of live vaccine. Since these vaccines introduce actual live pathogens into the body, it is an excellent simulation for the immune system. So, live vaccine can result in lifelong immunity with just 1 or 2 doses. And also, there are disadvantages. Because they contain living pathogens, live attenuated vaccines are not given to people with weakened or are not given to the poultry with weakened immune systems. The next one is the killed vaccine. It is prepared from bacteria or viruses that have been inactive and processed, thus will not spread from bird to bird and requires individual injection. Killed vaccines are usually combined with an adjuvant, such as aluminum hydroxide or an oil. Adjuvant enhance the immune response by increasing the stability of the vaccine in the body, which then stimulates the immune system for a longer period. The advantages of killed vaccine are assurance of administration of a uniform dose, safety, development of uniform levels of immunity. The second is no chance for spread of vaccine organisms to neighboring poultry farms, increased product stability, and a choice of a wide variety of virus strains. The disadvantages is our increased cost for labor and products, slower onset of immunity, narrower spectrum of protection and presence, and localize the tissue damage at site of injections due to reaction with adjuvant. And the next, we will move to the vaccine production. There are three vaccine production. Those are the liquid vaccine, gas, and freeze-dried vaccine. The liquid vaccine is in fluid form and ready to use. The next is gas, where the vaccine is prepared for administrations in the dry form. The last is freeze-dried vaccine. The vaccine is stored as one pack of freeze-dried material and one pack of diluent, often a sterile saline solution. These have to combine before use. And the continuation of my topic, Clarice will continue this discussion.
Medication. It is the administration of therapeutic agents to treat various infectious disease or condition. From the word medication, it is a medicating or being medicated, a substance for curing or healing or for relieving pain. Worms and helminthics, the worms. Worms, common nga atong nailhan is kining mga cystodes, flatworms, tapeworms. So, anthelminthics are used to treat people who are infected by helminths or parasitic worms. So, these drugs are also commonly used to treat infected animals in humans. So, next is bacteria antibiotics. So, antibiotics are medicines that help stop infections caused by bacteria. They do this by killing the bacteria or by keeping them from copying themselves or reproducing. The word antibiotic, this means against life. So, any drugs that kills germs in your body, it is technically an antibiotic. So, next is coccidia or coccidiostats. So, coccidiostats are antiprotozoal agents that act on coccidia parasites by inhibiting reproductions and retarding to development the parasites in the host cell. They are most commonly used in the poultry populations by addition in the feed and the authorized levels and observing the prescribed hygiene requirements. So next is fungi, antifungals. So fungi are the eukaryotic non-phototrophic living organism with rigid cell walls that belongs to the fungi kingdom. Fungi are some of the most widely distributed organisms in the world. So, antifungals. Antibiotics are used fungus infections which are most commonly found on the skin, hair, and nails. So next is lice and mites. So lice are small insects that live on the skin. They are often connected to the hair on the scalp in the public area. Kung naaday kay kuto, ang tawag di ana is rediculosis, scabies or scabies. Is a condition caused by mites which are tiny insect-like animals that dig under the skin. Next is vitamin and mineral deficiencies. Vitamin and mineral supplements. So, vitamins and minerals are organic compounds that our bodies use in very small amounts for a variety of metabolic processes. So, basically, they keep us healthy and help our bodies function. So, we get vitamins and minerals from foods we eat. For most of us, healthy and varied diet, it's all we need to stay healthy. It is the best to get vitamins and minerals from eating a variety of healthy and refined foods. So, vitamins and mineral supplements may recommended in a certain circumstances to correct vitamins and minerals deficiencies, such as folate for women who are pregnant or planning for pregnancy. So, others who may be at risk of vitamins or minerals deficiencies include people who smoke, drink alcohol, and exist or use illegal drugs. Second is crash daters or those who very strict diet para lang jud ma-achieve ang ilang gusto nga lawas. Then third is people with food allergies. Katong tao nga sige kaon sa mga allergy o mga pagkaon. Then take dik tambal kay nitukar na ilang kuan kanang allergy. So last one is woman with heavy period. So katong mga babae nga mga gipang dysmenorrhea. Kasagara gyud ana pati ako. Kanang mo take dik tambal basta mo tukan ng dysmenorrhea which is dili gyud ay maayo nga permintiho. I like kada dugo na lang gyud mo inom ana. So remember everyone, supplements are a short-term measure and should only be taken on advice from your doctor or dietitian. So dili nang gyud ta magpataka-taka og inom og mga supplements without permission sa doktor o sa inyong dietitian. So next, commonly used medication are, first is coccidiostat, aprocleum, moninsin, maduramincin, and DOT. Second one is anthelmintics, atildazole, fenbendazole, and piperazine. The third one is insecticide, acaricide, botox, sumitiop, malation. And the fourth one is vitamin and mineral supplements, mineral mixture, vitamin A, B, C2, D3 key, vitamin B complex. And the last one is antibiotics, efloxacin, neomycin, ciprofloxacin, thiocin, and gentamicin. Debaking. It is also known as break trimming. Bake trimming. In the poultry management is the act of reducing the length of the break of poultry birds. While the term debake implies that the entire break is removed, in the fact usually less than a third of the upper break in trim, and not all the whole break. Advantages of debaking. First is that debaked chickens tends to be more docile and less aggressive towards each other and humans. Second is it avoids problems like cannibalism or self-mutilations in flocks. Third is chicken also tends to make less noise without the distractions of peeking out at each other's feathers or beak. Fourth is the baked chickens are easier to handle, making them easier to move around for inspections or transporting to slaughterhouse if they raise from meat productions. Fifth, another benefit is to prevent hens from injuring themselves during egg collections, which can happen when a hen flap its wings in excited states while being held by worker collecting eggs. And the last one is the baking can help to keep the chickens' living environment clean by preventing them from spreading their feces around the coop. Disadvantages of debaking. First is that debaking chickens may experience increased sensitivity to pain in the remaining portions of their beaks. Second is, in some cases, the bake may heal improperly, resulting in the disfigured bake. The third, if not done correctly, the baking can also lead to infections and death. Fourth is chicken that have been debaked may also have trouble eating, leading to malnutrition or starvation. The last one is the baking can also caused by psychological distress in chickens, leading to abnormal behavior.